Hello and welcome. Today's session is about the overview of medication assistant treatment, or we call it MAT, M-A-T, because addiction is a disease, and our goal here is to help educate and bring awareness to the options available for recovery. And that's what we want to talk about. This is just an educational session to bring awareness to what's available in our community and how we can help those in need. In 2023, 105,000 people died from overdose. In 2023, that's a large number. Also, 217 of those people, 217, died each day from an overdose. We need to make it available that people can get the recovery. People did not wake up and say, I want to be an addict today. I want to live my life as a drug and alcohol addict. But we are here to bring the awareness, bring the education to you, also the options available for recovery, also how it became an addiction. It could have been the use of, you could have had a surgery and you start taking a drug for the pain, and it could have escalated to a point that it was uncontrollable. And so we want to have options available, and we don't want to get rid of the shame that might be attached to it. So what is MAT? MAT is not just about um, medicine or medication. It's a comprehensive approach that you would take medicine and recovery. It's an evidence-based treatment for substance use disorder, and it has FDA-approved medication with counseling. You have to have a doctor approved to take this medicine, but it helps improve long-term recovery outcome, and it helps manages cravings and withdrawals. And so it's important for the person that may be addicted to any kind of drug or opiate that or alcohol. It may help them with the withdrawal symptoms and create long-term sobriety, because that's what our goal is, to help the clients stabilize themselves, to help no shame, stabilize with those struggling with addiction, to reduce the risk of overdose and relapse or even death. It matters. So today we want to learn about medication assisted treatment, MAT, because it matters. It supports housing stability and employment. It can improve the quality of life for a person that didn't know that they can have it if they've had constant relapse and relapse. So, how do we get it? This is how we get it. We collaborate. We learn that addiction is a disease, and collaboration is essential for the success. Together, we're better to prevent alcohol and opiate abuse or related death. We want to provide the best service in our community, and the only way we do this is that we collaborate. Because if we raise awareness and remove the shame, then we can create community partners. And when we create the community partners, we work as a team to make sure that this disease of addiction is helped and cured, and the person is living a fulfilled life. And it's really simple. It's very simple, because all you have to do is you make the referral. If you work in a social service agency, you need to have resources available. Connect with partners. Create the partnership. Connect with clients that provide MAT providers. And then when they get there and you make the referral, they'll screen, they'll do the intake, they'll evaluate, and the treatment will start with supervision, their supervision, and ongoing support. You may, if you're in a nonprofit organization and you made the referral, you may be the one that did step one, the referral, and step six, you followed up on ongoing support and recovery services, because that creates the team. That's where the whole team is working together to make sure recovery is available to everyone. And so here's some resources we have in the Los Angeles, California area. I want you to take a picture of the screen, or take the time to jot these down, whether it's the phone number or the names, because then you have a community that you can develop resources for people, because a lot of times people don't get the help because they don't know where to go. They don't know what to do. They feel hopeless. And so if you connect with social service agencies like those mentioned on the resources here, then you can provide more help for those. And there might be part of the MAP program is what they need to stay clean and sober. It may not always work the way you work or how you got your clean and sober. Some people went to a 12-step program. Some people just stopped and quit and never use drugs again. So everybody has a different way to get clean and sober. But some people may need medication, and they need to have it without shame or anything that will hinder their recovery process. So look at some of the information here. And if you work for a social service agency in the Los Angeles, California area, I suggest that you look online. You can choose Change California at choosechangeca.org, and you can look at the directory and the websites and find something local for what you need or your client needs. But definitely connect with partners. Connect with partners and make it happen. It's very important that we do that, because if we take the shame out of it, then we can help somebody. And that's our goal, is that we would help somebody, because they did not wake up and say, I want to be an addict today because they had back surgery and they took pain medication, and now they find themselves in a hopeless loop going round and round without the help they need. So please be a partner and help solve the problem. Don't be a person that puts salt on the wound. Help our wounded to get stronger, because God uses ordinary people to do extraordinary things, and you may be that one that will do something extraordinary to help save a life today. So collaboration help us save lives. I'm Dr. Simmons, and I'd just like to thank you for letting me be of service today.